Hi, Jacqueline. My name is Sharon Alexander. I'm the patient care coordinator for the postpartum newborn nursery unit. I would like to interview you for 5 to 8 minutes, and I would like to interview you about the position that we have here at the hospital. I would like to tell you a little about the unit, which consists of 30 private rooms. As usual. Our nursery consists of 12 cribs, and the nurses do cross train from mother baby to newborn nursing. Now, can you tell me a little bit about your experience?
Yes, I started working in the mother baby department in I'd say about the early of 2011. I was in a small rural hospital out in Stuttgart, Arkansas. We averaged about 360 deliveries annually. Our labor and delivery was a 3-bed labor and delivery area, beds. And then I also had triage that I managed myself, and then also a 5-bedroom postpartum. Then we also had a low care nursery. So anything that was high risk or anything was always flown out.
Can you tell me about something about your dislikes at your last place of employment?
I have a lot more likes than dislikes. On my on my dislikes, the only thing that I really had was that because of our low census and everything, I was always sent out to other units. ICU primarily, which I was okay. I mean, they made sure that I was comfortable there, but they would send me to ICU. I would also go to med-surg, basically things that were outside of my range as a mother baby nurse.
Well, at this hospital, we only cross-train to our newborn nursery. We do not float to other units, and this will make you feel comfortable. Now, can you tell me your likes?
I had a lot of likes. The main one that sticks out is my continuity of care. I got to see my mothers from triage to labor, delivery, and then also postpartum, and then also their postpartum care along with their teaching of newborns. I really like my first-time mothers, getting them trained and trying to get them used to being a cohesive family. And I got to witness watching that family come together, and that really touched my heart a lot.
Now, what do you mean about family?
My unit we were very cohesive unit. We were very helpful of each other. We didn't separate each other saying, oh, that's day shift, that's night shift. We pretty much blended together as much as possible. We were friends both at work and also outside of work. We would go out and we would meet with each other and celebrate birthdays and a lot of things along that area. We helped each other out whenever possible, especially now because of all the snow. It just reminds me of plenty of times that I've gone out with my truck and helped dig out some of my fellow coworkers so we can all go to work.
What brought you here to this hospital?
What brought me here was that I felt that being out in a rural hospital, I wasn't really getting the well-rounded experience that I think a mother baby nurse should have. I had a lot of low to maybe medium risk. And even my medium risk mothers I didn't have enough of them, I felt. And I really I don't have any experience with high risk. And that's something that I really wanted to expand upon, was that I really wanted to get more known with, high risk mothers and everything, because my experience I feel very lacking.
Is there anything you would like to ask me? Any questions?
Yes, I do know that this is a much bigger hospital, and my chain of command that I'm used to is small. What would be my chain of command?
Your chain of command would consist of you report to the charge nurse. Have any disagreements or any problem, then you go to the manager, and so on.
Okay. And on a daily basis, who would I be reporting to?
You will report to the charge nurse on the unit.
Okay. And so I actually have just one last question. Do you have, it's a question for a question. Do you have any questions about my resume that I submitted? Anything that I had not cleared or explained properly?
No, I see you did put down reference on request, and we do report back to you within 2 weeks. if we, want to hire you or, or not.
Okay.
So, thank you so much, Jacqueline. It was nice meeting you.
It's great.
And you should get something to
Okay, great. Thank you.